Well, good evening, ladies and gentlemen, and welcome to Wednesday Wisdom. You know, this is this place every week that we get to meet, and I get to lay out all the practical applications that we see going on in our practice every single day that we help patients reverse their type 2 diabetes. I know a lot of you, you've never heard those terms before, actually being able to reverse diabetes, walk away from diabetes. Well, we just got done with a 5-day long masterclass where we lay out all the steps, all the strategies that we take day in and day out to help people accomplish their goals. Mainly, you know what we call this group, right? Mainly them being able to live a diabetes-free life again. For today's topic, what I want to do is I want to talk about and keep building on something called fatty liver disease. The medical literature describes fatty liver disease is infiltration of fat, both dietary fat created by your own body, and that's getting put into your liver. And what winds up happening is your liver actually gets plugged up to 70%. Hear this out, right? Up to 70% people walking around with type 2 diabetes also have fatty liver disease. That might be you right now listening to me. If you were one of the attendees of the most recent Diabetes-Free Life Masterclass, you know that the liver is one of the main organs that actually help you control blood sugar. So this is a really, really important topic. In fact, so many of you probably watching right now, you're on medication that specifically decreases your liver function, whether you know that or not. And that's part of what we call the diabetic cocktail that almost every single diabetic patient gets put on. Once you get diagnosed, you guys know this, you get put on cholesterol medication, the metformins, the high blood pressure medications, right? You've heard of all these. Now, when your liver is fatty because there's a disease process going on, your job as a diabetes patient is to figure out, well, how does your liver get unstuck? How do you get it back on the road to recovery? How do you get it back on track? Most people have never heard of that, probably because, that's not the hallmark that you hear at your doctor's office, but it is definitely the hallmark of what turning diabetes is part of. You got to figure out where the problems are coming from. You got to remember that, right? Taking steps to reverse your fatty liver disease is a hallmark of a good provider. So if your doctor is not talking to you about these things, then you need to be aware of it, because ultimately at the end of the day, it is your responsibility. You have to be able to see it on paper. You got to see that the numbers are improving, and you absolutely have to see that things are moving in the right direction. And they're moving in the right direction because you're on purpose. Right? So let's get back here and we're talking about fatty liver disease. It's infiltration of the fat into the liver, and the liver gets plugged up. Up to 70% of diabetic patients are walking around with fatty liver disease. And again, they have no idea that that's the case. And this is a crucial point that I want to talk to you about. In order to reverse your diabetes, your liver needs to be on your team, so to speak. If you have this unrelenting fatty liver, your disease is going to be a constant struggle for you. There's no way getting around that. Your liver is one of the main 4 detoxifying organs inside of your body, and it helps you control blood sugar. It helps you get rid of chemicals and compounds that actually drive up inflammation. And we all know that all disease process starts off with inflammation, but this inflammation that we're talking about coming from your liver can drive diabetes, it can drive obesity. Yet when I look at a fresh case of diabetes, somebody who was recently diagnosed as being a diabetic, the standard of care that's out there, these treatment plans, they do nothing to help this. They do nothing to help fatty liver issues, right? They do nothing to help bring your liver back online, so to speak. Nothing except just bully your liver. And how do they do that? By trying to shut down its actions. They put you on these diabetic cocktails, these prescriptions that we've just been talking about. What we want you to think about is, what are the actions, what are the steps that a fatty liver actually needs to have happen to turn it around, to put it in a new direction? First thing that you want to do is you want to lighten the burden. You want to lighten the burden of the liver and lighten the burden of detox by lessening something as simple as just lessening your fat content, just even for a short period of time. Listen, I'm pro dietary fat, but only after you get your liver unstuck. Maybe taking 2-3 weeks in a row of a low-fat diet is really important here. It allows your liver to start beginning to clean up, start cleaning up the process that it's going through, the reasons why it's stuck, so to speak. Second, after doing that, introducing things like high-quality dietary fat into your daily habits, right? That's super important. Dietary fats rich in things like omega-3s, dietary fat associated with clean animal products. By doing this, you begin to put demand on the liver to start producing bile again. And bile is the result of liver detoxification. It helps break down and digest dietary fat, and it drains things out of your body like contaminants, detoxification. It moves it through your gut and out of you. And these steps are done almost no one does these, right? Because you're going into your doctor's office and they're not even talking to you about this. If at all they ever mention to you that you've got fatty liver disease, and that leaves your fatty liver just clogged, it's plugged, and the detoxification doesn't happen. So how should I say it? Like your exits are closed off. You have to leave detoxification. You can't leave these exits closed, or what winds up happening is the liver just continues to get plugged up and more plugged up. You can expect to have increasing blood sugar numbers as a result of that. When your liver's plugged up, you can expect to have more body weight increase, decrease energy. I mean, heck, we see it all the time with patients. Things like unrelenting joint pain. You can start hitting the off switch by improving liver function. All of a sudden, these aches and pains start going away. It's always pretty amazing when we see it, but you got to figure out where it's coming from in the first place. And we're talking about this today because when we talk about what's happening in the standard of care that's out there, no one's looking. It's what we call it's underrepresented. It's under discussed, right? I'd go far as say is it's between maybe, for most people who have blood sugar issues, maybe as much as 30 to 50% of you right now, you're dealing with some kind of liver issue. And the standard of care that's out there doesn't talk about it. And that's why we're making this such a big deal about it right now. It's just a thing where they look at it and they look at you and they say, well, we're just going to sit and watch, because there's no prescription that makes fatty liver disease go away. You got to figure out why the fatty liver is there in the first place. Like, their plan is to just watch and watch and watch to the point where there's no help. And fatty liver disease can lead to liver cirrhosis and, God forbid, even worse complications where we talk about things like liver transplant. You gotta look at it differently. If you have fatty liver disease and you're not working on it day in and day out, I encourage you to make sure that you get yourself dialed in. And you get dialed in this group right here. Arm yourself with the latest medical literature. And then after you have this information that we share, and we share it in the 5-day Type 2 Diabetes Transformation Masterclass, when you take that information, implement. Make this part of your new routine. These dietary strategies that I just talked about here today, it can help. It can help identify things like chemical issues that are clogging up your livers. That's key. It all starts with figuring out why it's there in the first place. When you figure out where it's there in the first place, then you can make that corner to turn it around. Remember, 2025 is the year to be alive, and it's the year to turn your diabetes around. Be encouraged. Make yourself aware of these issues. Take the steps you need to in order to actually put your life back on a path of health and healing. You can do it. You know it. We've seen thousands of people already be able to do it, right? Make sure you stay yourself plugged in. Make sure you realize this is your community. The more you stay engaged, the more likely you're going to be able to use these informations, these strategies that we share with you every single week. All right, I think we're going to wrap it up for today. Wish you all blessings.